Time for a quick breather, but coming up next, conventional surgery to treat varicose veins are painful and require long recovery periods. We'll hear more about a new procedure that promises less risk and quicker recovery.
Good to have you, Primetime Morning. It's 8:50 a.m. exactly. We're moving on to our next topic, and we want to talk about varicose veins. They're also commonly known as spider veins, and actually they go beyond cosmetics.
Well, most people don't know this, but the problem is medical as well. The veins can become diseased, leading to heaviness in the legs, fatigue and pain, and leg ulcers that don't heal.
In fact, a global survey shows almost half of all women over 50 will develop varicose veins. But the condition is not limited there. Varicose veins can occur in teenagers as well.
The conventional way to treat them was surgery with multiple incisions, but now there are some other options. And we have Dr. John Tan, a vascular surgeon at the Vein Clinic, to explain what these are. He began by explaining just what varicose veins are.
Basically, varicose vein by definition refers to the veins in the leg that has become swollen or dilated. There are different types of varicose vein actually. Some people have the small type called the spider veins. It's called spider vein because it actually looks like spider webs. It is actually made up of small tiny strands of pinkish and purplish veins measuring less than 1 mm in diameter, and it is in the formation of a spider web, and usually present either in the lateral part of the thigh or behind the knee.
And spider veins don't necessarily pop up, right? Or do
they don't pop out. They don't bulge out at all. They are very flat on the surface. Varicose vein, on the other hand, is the extreme other group, which is a lot bigger. They measures anything from 5 mm to 15 mm in diameter, and they appear bulging. They sort of bulge us on the surface of the veins, and most patients, when they show it to you, they look like snakes with a twisted, tortuous location from the lower thigh to the ankle.
Is it life-threatening? Can it be?
Yeah, you're quite right. In fact, I would say a lot of my patients think that varicose vein problems are just purely a cosmetic issues, but that's so out of the truth, you know. Basically, varicose vein can cause a lot of symptoms. If you talk to patients who have varicose vein, they'll tell you that their leg feels very tired after like a few hours of standing. You know, they feel very heavy. They feel like an old man's leg or old lady's legs. And sometimes when they sit for a long time, the ankle actually swell up as well. And some patients actually complain that at night when they sleep, they get a lot of cramps. Yeah, cramps. A lot of people are very surprised when they tell them that cramps are due to the veins, because they think that cramps are due to electrolyte imbalance, salt deficiency and all.
Besides the unsightliness and discomfort, is there an underlying health issue we should be concerned about?
Yes. Apart from all these symptoms and unsightliness, if left untreated, varicose vein can progress to medical complication, and the commonest of which is something we call stasis eczema. Okay, let me describe that. Patient will start to notice that the skin around the ankle will change color from skin color to dark brown to black color.
What does that mean?
Yeah, and the skin will start to thicken, because what happens with varicose vein is that the pressure in the veins are so high that they start pushing out a lot of blood cells and plasma, which will form a protein layer around the skin. And this actually impede the oxygenation of the skin there, and which will lead to ulceration, which basically means a breakdown of skin. Patient will actually found like a hole on the skin in the leg, and it is very difficult to treat. Patient will tell you that they'll dress the wound for like a year on end without the wound showing any sign of healing. And that's just one of the possible complications. Obviously, varicose vein can also become infected with clot, and we know clot can be dangerous because clot can give rise to surface clot can give rise to deep vein thrombosis, which I think a lot of people are more familiar with what we call economy class syndrome, where you get clot when you fly for a long distance.
Of course, because the veins sort of have our blood flowing through it, so if it's clogged, a lot of things can go wrong. I mean, but in terms of treatment, can't you just give it a good massage? Perhaps don't be on your feet so long, you know, I mean, exercise. Will those things help alleviate the problem?
Absolutely right. I think those will help a lot as well. But I think exercising, massaging and all that does give you a temporary relief. If you do have varicose vein, all the aching and all that, exercising actually improve your symptoms. But all those things will not reverse what has damaged the veins, you know, and you do have to treat it in order to permanently get it to be sort of cured.
I understand surgery is an option, but we have a new technology out there. What would that be?
Traditionally, the surgery for varicose is something called surgical stripping. Basically, what we will do if the patient comes to me with a varicose vein is we will put them under general anesthetic, and then I will be making a few cuts on the legs, one in the groin, which is quite long, it's about maybe 2 or 3 inches long. Then a few cuts in the calf and the ankle as well. Then I will then pull out the whole veins, because this is the bad veins, right? This is varicose vein is a bad vein. It's a disease vein.
You put in a new vein?
No, no.
And it's okay to have one vein less?
Oh yeah, that's an absolutely good question, because almost every patient asks me the same question. Yeah. We pull out the bad veins. What happens is that because the vein that is varicose is no longer functional. You see what? Take one step back. Why you get varicose vein? Because the valve in the veins are defective. So your blood, instead of going back to the heart, is actually going down. So you end up with pooling and stagnation.
Right.
Now when that happens, your good vein has taken over the role of returning the blood.
Right.
The bad vein is just stagnant and causing all the problems that I described to you earlier.
Okay.
But I understand there's a minimally invasive new option that's available for patients out there.
Throughout the years of doing stripping surgery, we all knew there are a lot of disadvantages, right? General anesthetic risk, incision, cutting a lot of holes, and complication of pain and nerve injury. Instead of pulling out this long vein, I can put a wire into the vein, burn it, and close it, like what you can see on this animation. Basically, the doctor, what they'll do is, under an ultrasound guide, we'll get a needle into the vein, and then we'll introduce a catheter which will either deliver laser or radio frequency. In this instance, it's a radio frequency catheter, which once positioned, we can pull it out slowly, and the radio frequency will then slowly burn the vein. And this will then close the vein completely without having us to remove the whole vein, without having to actually make any cuts on the leg. And as a result, we can do it under local anesthetic.
Right.
So there's no need for general anesthesia with all its inherent risk. Secondly, without any pulling on the vein, there's also less damage to tissues, so less damage to nerves. So post-procedure, patient complain of less pain. They can get up immediately. They can actually walk as soon as we are done. And the recovery is a lot faster as well. Most of the patients can actually go back to work the next day without too much bruising or discomfort.
So effectively you're electrocuting the vein and zapping it so it dies, and then the body will recover and sort of heal it by itself, and the unsightly appearance will disappear as well.
Good word to use. I think we zap the vein.
But at the end of the day, you're still one vein less, isn't it? And it's a dead vein, so to speak, but you still keep it in there. Is that okay?
Not true. What happens is that if you scan the patient months later, the veins that we burn or zapped, like what you said, actually completely disappear. See, our body has the ability to know that that vein is dead, is useless, and actually it absorbs the veins, and the vein is gone.
Oh, it's a lot more serious than I thought. Varicose veins, not to be taken lightly.
Okay, I mean, if left for a long time, it can get worse. But I guess the key here is always get it checked out. You know, sometimes it's not too severe a case. Then you can decide what precautions to take or what steps to take next.
Yeah, the doctor there was frightening me a little bit when he said, you know, when you stand for too long and then your leg starts to hurt, and you know, because that happens to me from time to time. But I think it's because of my 4-inch heels.
Maybe that would be it, yeah. Because then you would see the veins, you know.
Right.
And I guess once you cut some of those veins out, then you could say you're less vain.
Yeah, zap the pain as you say it, right? It's just a zap away to cure your varicose veins.
Okay, you didn't get that right when I said you were less vain. Okay.